Rosemary, 9:13. The Center for Social Dynamics is dedicated to helping children with autism and their families. According to recent numbers from the CDC, 1 in 68 children have been identified with Autism Spectrum Disorder. Now, this group is headquartered in Alameda. It has locations, though, across the Bay Area and the state. And the CEO and founder, Pete Payadas, joins us now in studio. Thank you for coming in.
Thank you.
So let's talk about this. We were talking about the numbers of 1 in 68, and you were saying that there are resources now that help us identify children with autism and to get them the resources they need early on.
Correct. So now, with new mandate, health plans are behind these diagnoses. However, we still have regional centers. We still have organizations around that allow you to understand more about autism and the diagnosis behind it.
In terms of autism, what is the challenge to making sure that children and their families are getting their support? One of the focuses that you've talked about is multiculturally, getting the family to accept and reach out and really kind of build a pathway.
Correct. So I think that for many years, how families access services was a big problem. Now, the minorities seem to find services better. So there's still a lot of advocacy around, and I think we're obligated to provide this information because the earlier we get a child with autism, the more chances we have to succeed.
And what kind of work are you doing with them?
Just treatment, basic treatment, evidence-based treatment with the patients that we have.
We're looking at some of the people that you have working for you, and in terms of people who you are looking for to help you do the work, you're saying there's a shortage.
Right. I mean, the demand is so strong that we're lacking clinicians. We're lacking at all levels of clinicians. We're talking about the main one-on-one service provider to a supervisor to a BCBA, a board-certified behavioral analyst, or a PhD or a clinical psychologist. So a big part of my agenda and the foundation I created is to send people to college to be part of this industry.
Yeah, and the idea is so you get the people in, send them to college, get them to help, and then you get the children in early and really can set a good pathway for life for them.
Correct.
I want to talk about Jack because we were just talking about that. One of the first patients you ever treated with autism, he was 3 years old when you saw him. Tell us about Jack.
Well, I think Jack was, I think Jack was 2.5 when I met him, and we started focusing on his main weakest repertoires, which one of them was his lack of verbal behavior, of communication skills.
So he wasn't talking at all?
Language. Correct, he wasn't talking at all. So within a couple of years, not only he found value in communication, started talking, but he also, through this communication, this allowed him to start relating to others and find joy in relationships and communicating.
We're looking at pictures of him now. There he is, very young when you were treating him. He went off and continued his treatment in his life, and then 15 years later, there he is now, and he's come back. And tell us about Jack now.
Right, Jack is now a very talented young man with tremendous skills, marketable skills, and that's what we're doing here. So he's an 18-year-old now kid, young adult, that now he's my assistant. And I'm using his strengths and focusing on what he does very good and trying to strengthen what he needs to improve on.
Which is amazing. I think the reunion, I think for parents, and I have friends with children with autism, the future is what, you know, they want for their children to have a good, like what we all want for our children.
Right.
And to see that the end around
maximize their potential, have a successful and enjoyable life. And I mean, that's what we do here, the people that we choose to focus on healthcare.
So the message to families and children and even anyone who might be a care provider or someone who might want to go to counseling is what? You're needed?
Yes, please, we need you. It's a fantastic feel, getting here with us, very rewarding, a lot of opportunities.
Yeah, all right. Thank you so much.
Thank you very much.
Appreciate you coming in. The Center for Social Dynamics is on... well, you have a new headquarters in Alameda, correct?
Correct. So that's the old address now. We're at 1025 Atlantic Avenue in Alameda.
But I've seen your website. You have locations all across the Bay Area, and we'll put that information on ktvu.com. Thanks again.